I'm rarely frustrated. For those of you that have been following me for a little while, you'll know that I don't get that really annoyed and I try and put out medical information out there. But I wanted to talk about these new guidelines that have come out, and they have been out since the 12th of October 2023. So I'm a little bit late to this, but bear with me. Now, the reason these guidelines have come out is because, as you will say, the new data shows that the urinary tract infections lead up to 800,000 admissions into hospitals across the country. And this is something that I can verify as a doctor because I see this a lot in my clinics, and actually I do admit patients, especially those that are older. So in this particular data, they were looking at people over the age of 65 and older, because urinary tract infections can cause horrible symptoms: burning, stinging, tummy pain, infections, fever, can lead to something called pyelonephritis, which is an infection of the ureters and the kidneys as well. Can make you even land in hospital, because actually, especially if you're somebody that's getting recurrent urinary tract infections and you need to have recurrent antibiotics, two things that can happen. One is you can become resistant to antibiotics, and secondly, the course that we give for antibiotics, particularly women, which is a 3-day course of, say, trimethoprim or nitrofurantoin, just simply doesn't work. So you need to give a longer course, and if you're resistant to those, then hospital admission to get either cultures and then specific antibiotics given to you. So urinary tract infections is not a joke at all. It's something that takes up a lot of time in my clinic. In fact, I've done a clinic today and I've had 4 women and 1 man who've been on my call list as an emergency appointment just to talk about urinary tract infections. And when you get down to the bottom of it, there's a whole load of issues. So because there's so many different reasons why you can get infections, absolutely right. As you can see down below, they've written in the guidelines that older adults, particularly people over 65 years old, are more prone to UTIs, and both sexes can get UTIs. Now, we know that urinary tract infections are more common in women. It actually says that than men, because women have shorter ureters than men, and bacteria is more likely to reach bladder and kidney infections and go up the ureter and affect women a lot. So this is why we see disproportionately women are far more affected. So let's have a look at the advice that they've updated in the new guidance in October 2023. So bearing in mind everything that I've just said, and the fact that women are affected more, this is the UTI, NHS and UKHSA guidelines on how we manage urinary tract infections. Drink enough water regularly. Avoid holding pee instead of going to the toilet as soon as possible. Washing. Keep the genital area clean. And this is what's really frustrated me. Wash genitals before and, I'm going to move, after sex. That is the guidelines to prevent getting a UTI. As women, when we are older, we start to go through menopause. When we go through menopause, we reduce in our estrogen levels. When estrogen is reduced, we get what's known as Genitourinary Syndrome of the menopause, or vaginal atrophy. The fact that you're telling women, going, we know that this is a huge problem and toileting habits and behavior is affected, wash your genitals before and after sex, with no mention in the new guidelines about topical vaginal estrogen. It's crazy. Like these guidelines are what we as you are using as doctors, and they don't make any sense. Absolutely. So yeah, I don't normally get frustrated, but this has really frustrated me. And when someone says to me, we think about women all the time, this affects, urinary tract infections affect women the most. And we're talking about women consistently. How can you not think about women and genitourinary syndrome of the menopause and UTIs? Because this is what, as doctors, as junior doctors, say, who don't do women's health, are going to be coming up against. And this is probably the advice that they'll be giving other women. So I'm really disappointed and I'm really frustrated. But the battle goes on to talk about topical vaginal estrogen as a treatment and a prevention for urinary tract infections, because it works. You have to give the area back its estrogen, and we have to be thinking about women as being this cyclical, hormonal, transitional beings which affect our anatomy and the underlying conditions that we get. That's my frustration out the way. I'm working on these guidelines, I promise. We're writing to them and doing all sorts. So stick with me.